Hello, my name is Nicole Gaisford, and welcome to my presentation on feed mycotoxins for ANS 561 equine nutrition. I would like to begin my presentation today by taking a moment to define the term mycotoxin. Mycotoxins are secondary metabolites that are produced by fungi. These secondary metabolites have toxic effects on their intended sources whenever they are ingested or inhaled, usually. Mycotoxins also readily attack crops, and they cause disease or even death in some cases if they are ingested at too high of a dose. At this time, there are more than 400 species of mycotoxins that we have identified, but there are actually still many more out there that have not yet been identified. This is just a table that I found interesting when I was doing research for this presentation, and it shows here a breakdown of some of the major mycotoxins that affect horses, as well as the typical source of the toxin and the particular species of fungus that produces the toxin. I'm going to be going into more detail on these mycotoxins, or at least most of them, later on in the presentation, but I just kind of wanted to give you an overview of the major ones that affect horses. It's very difficult to classify mycotoxins because they have a variety of targets, consequences, and even preferred environments. But in general terms, because they are fungi, they prefer environmental conditions that are conducive to their growth, and this is usually cool or wet growing seasons, high humidity temperatures. Another preferred target are plants that are under stress. This makes them more susceptible to infestation and subsequently makes them more likely to produce mycotoxins. And one last one to mention are insect infestations. And these can be a problem because the insect can produce or even just carry the mycotoxin from source to source. And this can make it more likely for your horse to come into contact or to consume this mycotoxin. One last thing to mention is that exposure to large amounts of toxin in a short period of time, as you know, will cause toxic activity. But I found it interesting that there's not a whole lot of research out there right now that indicates the consequences of long-term exposure to small doses of mycotoxins. And so this might be an area for future research. Mycotoxins can be found in a wide variety of environments, and this can include, but is certainly not limited to, cereals, pasture, forage, your horse's bedding, hay, and so forth. Another thing that I thought was worthwhile to mention is that obviously we're talking in this lecture about mycotoxins that have detrimental effects, but there are some useful purposes, and this would include, in this instance, penicillium species that are used to produce antibiotics. The symptoms of mycotoxicity, once again, can vary greatly, and this depends on a number of factors, including the species that produces the toxin, the species that consumes the toxin, the amount of the toxin that has been consumed, and other factors. Generally speaking, however, some prime targets for mycotoxins include the liver, the brain and spinal cord, the kidneys, and the immune system. Mycotoxicity can be very difficult to diagnose because symptoms can start out very vague, and also they can resemble the symptoms of other diseases, but they can also resemble each other. So I'd like to continue on now by talking about some of the major mycotoxins that affect horses. I'm going to begin by discussing aflatoxins, and these are caused typically by Aspergillus and Penicillium species. Aflatoxins can be found in corn, cottonseed, peanuts, and cereal grains. And to the right here, you can see an image of peanuts that have been infected with aflatoxins. They are also suspected carcinogens, which makes them one of the more dangerous mycotoxins to ingest. And they are known for causing liver disease in horses, which is the primary action of the mycotoxin in this case. Young horses are particularly susceptible to infection with aflatoxins, and they are also known for causing abortion in pregnant mares. Aflatoxins usually result from grain storage issues, such as improper storage bins or storing your feed in a high moisture area. The symptoms of toxicity can appear within a few days of exposure and initially begin with feed refusal, and this is followed by decreased feed and water intake, weight loss, lethargy, bloody diarrhea, and even death if it's left untreated. And usually the best way to treat this is just removing the source, and this will halt the symptoms. And you can see here that I've noted that it's toxic above 0.02 parts per million. Fumonisins are another major equine mycotoxin, and they are known for causing equine leukoencephalomalacia, or ELEM for short. It's also referred to as moldy corn poisoning because the fumonisins in this case attack the root, the stalk of the corn, and cause stalk rot. And this is another one that's particularly dangerous because, again, it is a suspected carcinogen. Fumonisins are usually the result of pre-harvest issues. They like to form in humid climates, usually following heavy rainfall. And they typically infect cereal grains such as corn, which we just mentioned, and wheat. And in this case, older horses are the ones that are more prone to infection with fumonisins. And here I have listed that the toxicity level is less than 5 parts per million in this case. Symptoms of mycotoxicity will appear within hours to days, and again, they will begin initially with feed refusal, which is followed by lethargy, depression, facial paralysis, blindness, circling, head pressing, staggering, and lateral recumbency, and of course, death if it's untreated. To the right here, you can see an image that I found of a horse brain that was actually infected with fumonisin mycotoxicity, and you can notice that there are several areas where there are lesions, as well as to the left you can see areas of hemorrhage in the brain. In this case, fumonisins, the mycotoxin, actually liquefies the white matter of the brain if it's progressed fairly far in the disease. But again, you can remove the source of the toxin if you notice activity, and this usually halts the symptoms. The next species, ergot, is one of the oldest known mycotoxins. It produces hallucinogenic effects, and ergot toxicity may have been the actual cause of some of the mysterious activity that people were exhibiting and attributing to calling people witches in early history. These are produced by various species of claviceps, and they form dark bluish-purple spots that are called sclerotia in the heads of cereal grains and grasses, and you can see this to the right here on this wheat. Ergot is a common contaminant of pasture grasses, especially bluegrass and ryegrass, and they also like to contaminate cereal grains such as wheat, rye, and barley. Once again, they form during hot, humid, damp weather, and in this case, they're toxic to all humans and animals. and the level I have listed here is 450 parts per billion this time. The toxic effects on the reproductive system seen with ergot mycotoxicity are similar to what we see in fescue toxicity, and they include decreased udder development, thickened placenta, dystocia, poor colostrum and milk production, prolonged gestation, abortion, and weak or stillborn foals. And once again, as we've mentioned with the other sources, if you notice symptoms and remove the source, this is usually sufficient to halt the activity. Next we have ionophores, and these are a common feed additive in the cattle industry. In cattle, there are a lot of benefits to adding ionophores to the feed. It increases the weight gain and it improves the rumen activity, but in horses, they are extremely toxic, and in this case, there is no safe level of consumption. Ingestion could occur as a result of cattle and equine feed cross-contamination, and symptoms will appear within hours because the ionophores are readily absorbed into the GI tract, and they also affect muscle contractility. The symptoms of mycotoxicity in this case include anorexia, sweating, depression, lethargy, ataxia, muscle weakness, and cardiac arrhythmias. This is a rapidly deadly disease to horses, but that said, it can also be treated if it's caught early enough. The treatment would include IV fluids, administration of activated charcoal, supplementation with electrolytes, and anti-arrhythmia medications. The best prevention is the best option in this case, and so you should really consider buying your feed from ionophore-free versus ionophore-safe facilities. And you should also remove any potential sources of exposure, cross-contamination, etc. Blister beetles are an interesting one, and they produce the cantharidin toxicosis. It's usually a particular genus, the Epicotta genus, that produces this toxin, and they typically infest alfalfa hay. And as I've noted here, they're toxic at a level of 0.45 mg per kg. Blister beetles are a particularly dangerous mycotoxin in some instances because they are so difficult to remove or sometimes even notice. They're resistant to heat and drying, which makes them able to withstand a lot of the hay processing procedures. They're also odorless and even colorless. Once they're ingested, again, they rapidly invade the gastrointestinal tract, and usually clinical signs will appear within about 6 to 8 hours. The signs of blister beetle toxicity include colic, restlessness, irritability, sweating, diarrhea, mucosal hemorrhage, an inflamed urinary tract which can cause issues such as dysuria, and the classic cantharidin toxicity symptom, which is submerging the muzzle in water. Toxicity in this case can again be fatal. Early detection is the key, and treatment is usually just symptomatic and includes, again, removal of the infected feed. For the last part of this presentation, I just want to briefly go over some common pasture toxicities. And first is fescue toxicity. I'm only going to briefly mention this because this is a topic for a whole other lecture, but I thought I should just mention it. It's caused by endophytes. As we mentioned with ergot toxicity, it has very similar reproductive effects, including dystocia and stillbirths, as well as decreased average daily gains. Sweet clover spoilage is caused by Mellolotus species, and what it does is converts the coumarins that are in sweet clover to dicumarol, and dicumarol is an anticoagulant. Death can result pretty quickly in this case from massive hemorrhage because the dicumarol in this system actually decreases or stops the synthesis of prothrombin. The best way to prevent any possible toxicity in this case is to properly manage your pasture, rotate your crops, etc., and also to, once again, be diligent about your storage conditions and preventing humidity and dampness to enter into your storage containers. If you do have a horse with this toxicity, the treatment would include removing the source of the pasture and administering vitamin K to encourage normal blood clotting procedures. Red clover toxicity is caused by Rhizoctonia species. These again develop in wet, humid conditions, and they produce a substance called saframin, and it targets the parasympathetic nervous system and produces symptoms within several days. And these symptoms include excessive salivation, which they commonly call in this instance the slobbers. Symptoms also include increased water consumption, weight loss, diarrhea, and frequent urination. In this case, a horse with red clover toxicity would also be at increased risk for colic and dehydration. The last toxicity I'm going to mention is outside clover, and these clovers produce alkaloids that primarily cause liver damage, leading to icterus, which is yellowing of the mucous membranes, and it can also secondarily produce photosensitization issues such as sunburned skin, etc., after several months of exposure. If you frequently mow your pasture and use herbicides, this will help control the risk of exposure to this toxicant. I mentioned many ways to prevent exposure to certain toxins throughout this presentation, but I thought it would be helpful to just list several of the ways that you can help minimize any exposure to toxin. And this would include removing the feed at the first suspicion of a toxic event. It includes properly storing your feed and your grain, having proper ventilation where your feed and grain are stored, cleaning your feed troughs, your buckets, your scoops, everything, making sure that they're well cleaned and cleaned often. You should always visually inspect your feed, look for anything that looks suspicious. You should follow the sell-by dates that are on the packaging carefully. Make sure you're not using something that's out of date. And we mentioned several times removing, the pasture or whatever that you're using if it's causing a problem, rotating your crops, using herbicides and insecticides as you need them. And also, you should also buy your feed from reputable sources who are, for example, an ionophore-free facility. This wraps up my presentation on equine mycotoxins. I want to thank you for watching, and I hope that you have enjoyed the presentation.